Part 2 of the 2025 Medicare Part D plan changes. Hello, I am Kevin Canals with InsureMeKevin.com, an independent health insurance agent in California. And there are some significant changes to the Medicare Part D drug plans that apply to the standalone plans that you may have with original Medicare or embedded into a Medicare Advantage plan. Some of the significant changes is that there is now a $2,000 maximum out-of-pocket amount, so that once the beneficiary hits that, they're done paying for their drugs. The coverage gap has been eliminated, so it's just potentially deductible, the initial coverage phase, and then the catastrophic phase, which has all your drugs covered once you have reached $2,000. And now there is a new Medicare prescription payment plan that some people may be able to participate in, and that's this video focuses on. So let's go over kind of what a alternate design drug plan may look like, and then how that payment plan may fit into it. So one drug structure that Medicare allows the plan sponsors to offer to their plan members has a drug deductible of $590, because that's going to be the new deductible for 2025, but it only applies to tiers 3, 4, and 5, those brand name and specialty drugs. Tiers 1 and 2, those generic and non-preferred generic drugs, they go straight into the initial coverage phase. Once the plan starts, are not subject to any deductible. But when all of it reaches $2,000, the individual has met their maximum out of pocket. So in the earlier video, we went through and we showed how, in the first month of January, the individual had to pay the full list price for that tier 3 drug because it's subject to the deductible of $400. And then in February, they had met their drug deductible. And you can see that the tier 3 drug went down to $295, a total drug cost of $305. And this column that says MOOP accumulation, that's the maximum out of pocket. So you can see in January it's 410, the 305 of February makes it 715. In March, the individual is paying 50% of the tier 3 drug. That's how that particular plan has it set up, that tier 3 drugs are 50% coinsurance. Their total amount for the month is $210, and that is now $925. And then you can see how those drug costs in the initial coverage phase, they accumulate. So for May, we have $1,345, August, $1,975, and then in September, they meet the maximum out of pocket of $2,000, and everything's covered for the rest of the year. But meeting that drug deductible for some people can be difficult because they're on a budget and things are very, very tight. And if you're not getting extra help from Medicaid, Medi-Cal in California, then it can be costly. So Medicare has told the plan sponsors they can set up a payment plan to spread those costs out through the year. And it's a little bit complicated in terms of the math, but this is what it may look like. Now, first off, you can opt into the drug payment plan as soon as, in January, or you can do it later on in the year, and you can also opt out. But let's look at this particular situation. January, their drug costs are $410 because they're paying for that tier 3, the full price, and the $10 copay for the tier 2. Now, if they opt into the payment plan, they would be making a payment of $34.17. So that is $410 divided by 12 months, because everything needs to be paid for within that calendar year. Now, the next month, they have drug cost of $305. Of course, that accumulated to the maximum out of pocket. And the payment plan is $61.89 because it is the total cost of the drugs for each month minus what has been paid through the payment plan divided by the number of months left in the year, which is 11. So you can see we go through March, April, and May because now the drugs are set at $210. Both the tier 2 and tier 3 are in the initial coverage phase. And the payment plan cost goes up because as you go through the months, it's the remaining balance is divided by fewer and fewer months. So the monthly payment on the payment plan by June are $162.48, even though the plan member is incurring $210 in over-the-counter drug costs. And then we can see that continues for July and August. And then in September, that's when this individual hits their maximum out of pocket. And only $25 is added to the overall drug cost. And that number and the remaining balance is divided by the remainder of months, and it comes out to $245.73. Because the drug costs are covered for October, November, and December, because the individual has met that $2,000 maximum out-of-pocket amount. The payment plan does not change because we're not adding to the cost of the remaining balance of the drug cost. It's just a flat $245.73 through December. And then you can see the totals. The $2,000 in the red is the maximum out-of-pocket amount that the individual hit, and the payment structure equals $2,000 at the end of December. So is this a good deal? For people who have tier 1, tier 2 drugs, they have a very low copay, they're never going to hit a deductible, it may not be of any real benefit. For people who do have high cost drugs right in the beginning of the year, it's going to help smooth that out. But of course, as you can see, this individual is paying in October, November, and December more on a monthly payment plan than they did in the previous months when both drugs went into the initial coverage phase. So is that worth it? Well, it may have been a real stretch in January and February to come up with $410 and $305 respectively to meet those pharmacy costs. So it's a little bit complicated. Again, you can opt into the program at any time. The later you opt in, the fewer the months there are to divide the costs. You can opt out of the plan, the premium payment plan, or the drug cost payment plan at any time. But then again, you would be responsible for the full amount that has accumulated up to that point. So you have to kind of really look at what your drug costs are going to be early in the year and how this may help smooth it out. So there's other issues that are going to be going into this because they haven't released all of the particular details on how this is all going to work, but the plan sponsor is going to be administering it. You would just, if you opt in, you go to the pharmacy, you get your drugs, they'll see that you're on the payment plan, the pharmacy sends the information over to the plan sponsor, and they start doing the calculations, and then I guess sends you another bill for a much lower amount, especially if it's in January and that drug cost is being divided by 12 months. So that's one of the big changes for 2025 that Medicare beneficiaries can opt into is this payment plan for their drug costs, but someone needs to help you. If you're not good with these spreadsheets and numbers, see if it's going to be of any value to you. We don't have all of the information. We're getting some of it from the plan sponsors and how it's all going to work. But if you do have questions or comments, you may leave those down below, and I'll do my best to answer them. Otherwise, for InsureMeKevin.com, I am Kevin Knaus.